Highest single day spike. This is how the rise in coronavirus cases in Tamil Nadu has been described for the past few months. The headline sounds striking, but there's another bit of information. The state has recorded the second highest number of coronavirus cases in the country, next to Maharashtra, but is also testing more than 50,000 persons every day. Here are 5 lessons other states can learn from Tamil Nadu on handling COVID-19. 1. Early detection. We are literally chasing coronavirus to catch it at the earliest, was what Dr. J. Radhakrishnan, the State Health Secretary, said in June. Every person entering Tamil Nadu by road, rail, air and sea is checked for his temperature, and only if he doesn't exhibit any symptoms is sent home and advised strict home isolation for 14 days. Anyone showing symptoms of COVID-19 is transferred to a COVID care center. Dr. Parandaman, the head of the Department of the Medicine Ward at Keelpark Medical College, said, "The government is doing a wonderful job and COVID care centers over 50 to 60 have been started only in Chennai. Every week we discuss advancement in the medical field in terms of treatment and scientific advancement. We keep changing protocols, treatment and diagnostic strategies so we are able to implement the effective measures to tackle the disease." The Chennai Corporation has deputed workers in every area who go door to door to check on every family member's temperature, blood pressure and thyroid levels.
You need to approach this scientifically and not be affected by the issues of rising cases and increasing hospitalizations and all that. Because the more you test, the more you find out, the more you can isolate, the more you can contact trace. The more you contact trace, the more you quarantine those who are infected or likely to be infected. And you can manage them better because they can access hospital help early and be treated appropriately, because we find that most of the deaths occur in situations where they come too late to the hospital.
2. Aggressive testing. During the initial period of the pandemic, the state was criticized for the low number of testing done. In the first week of April, the state tested around 2,700 samples, and by the end of the month, it was about 9,643. By 22nd July, the number had crossed 50,000 persons every day. As on 23rd July, Tamil Nadu is number 1 in testing. Over 21 lakh persons have been tested so far, ahead of Maharashtra, Delhi, Karnataka, Andhra Pradesh. There are a total of 113 COVID-19 testing facilities in the state.
Tamil Nadu has done a stellar job. In spite of the media hype and the saying that everyday cases are rising, Tamil Nadu didn't give up. They kept testing, which was a very wise thing to do. This has helped, contain things better, know more knowledge, ensure that the mortality stays low.
3. How the sudden spike in other districts is being managed. While May to June saw many districts record single-digit number of cases and some days even 0, July saw many districts climb the ladder. However, there has been a steady decline in the number of cases in Chennai. One major reason cited by experts is that when the lockdown was lifted, several left Chennai to their hometowns, thus causing a spike in Chengalpattu, Tiruvallur, Madurai, Kanchipuram, Velur, Tiruvannamalai, Thoothukudi and Virudhunagar.
This is again inevitable. Chennai, Bombay, maybe Ahmedabad and Delhi were ahead of the curve, where predominantly the cases occurred, and now anything sort of after some time will slowly plateau and come down. We are in that stage. It is now Hyderabad, Bangalore, Trichy, Madurai, which are all taking up now. This is not unexpected. In a couple of months' time, when Tamil Nadu becomes hopefully close to 0, the other states will still be at their peak, and that will take time to come down. There is a possibility that a second wave will hit after 3-4 months. So we have to be prepared for that.
The State Health Secretary has assured that they have increased testing in the districts, allocated 1 officer to monitor 300 persons, movement in and out of containment zones strictly curbed, daily check of the residents living in these areas. 4. Masks and social distancing. The state is strictly instructed that those found not wearing a mask and violating social distancing will be penalized. Everyone is advised to shop only in a 2-kilometer radius, work from home, and avoid any travel that is not essential. Customers will not be allowed to shop for groceries, essentials, clothing, anything for that matter, without a mask. Police personnel dressed as goddesses, god of death, even an ambulance with a fake COVID patient to freak out those who are not wearing masks. The state is trying many innovative methods to impose the rule. Senior virologist Dr. Jacob D. John had proposed that the best weapon we have, that is equal to the lockdown while maintaining economic stability, is 100% mask wearing. 5. Just a lockdown cannot stop COVID. While the lockdown has definitely helped in curbing the spread of the virus, experts say that it is not a rational decision to impose a lockdown every now and then. However, due to shortage of staff to implement a focal quarantine strategy in areas which have recorded high number of cases, Tamil Nadu had to resort to extending the lockdown in July. Also, it is vital to have a comprehensive scientific team of public health persons, clinicians to advise the bureaucrats, and a good communication with the police, health department, corporation, and the press for effective implementation. Community participation and cooperation is key to fighting this pandemic. Both these elements have been seen in Tamil Nadu.